Welcome back to Houston Life. Spring is here. The wildflowers are blooming. The roller coaster we know is Houston weather. Well, that is here in full force.
Okay, dry skin, dead skin, excessive sweating.
Yeah.
Whatever you're handling or
Spicy
dealing
salsa.
with, we're all dealing with it too. And our next guest is ready to help us face it all. Dermatologist, our friend Dr. Sherry Ingraham joins us now with some springtime solutions to help us sort of refresh and reset during the spring.
Yes.
And this is the thing. I mean, does your advice change every single day? Because it seems like the season's here in Houston.
Right now, we're in that weird transition where it's hot, cold, hot, cold, hot, cold, which we'll talk a little bit about, but we are going through that more of that humidity change. So as the ambient humidity gets better, we can do a little more exfoliating. Our skin barrier will tolerate it a little more, so we're gonna get into that. But the first thing you gotta do is spring clean everything. So get your gym bag. We have this nice vibrant gym bag. Take your gym bag. I love this little spray alcohol. You can get a little washcloth and wipe out your gym bag once a month. It does grow bacteria. It will get on your stuff and cause acne and backne and body acne. If you're a man and you have a great little travel bag, wipe this out once a month with a little alcohol. You can even use, sometimes I'll use hand sanitizer on a trip. Also your makeup bag. This is embarrassing, my makeup bag. A makeup bag that's aerated does better, but you need to wash your brushes. And I always say wash them once a week, and who does that, but twice a week. Get a little detergent. All you have to do is use kitchen soap and then leave them out to dry. And then the most important thing is mascara. When it smells, throw it out.
Toss it out.
3 months is the half-life.
Because there are little bugs in there, right?
Absolutely. You get conjunctivitis, and once it starts to smell, throw it away.
And the makeup brushes too. So you could just use dish soap, you said?
Yeah, dish soap is great. Shampoo is great. Or dish soap. You know, maybe if you have finer brushes, you want to use a little shampoo, but dish soap works great.
Okay.
And then we move on to getting your body exfoliated, ready for spring. But a lot of people use these at-home loofahs, at-home. These synthetic ones are safer. They don't grow as much bacteria, but I always tell people once a month, wash them really good again with detergent. Dish detergent, rinse them out. Razors are really, these disposable razors, I tell my children, throw them away every 2 weeks. Because they get rough and they grow bacteria.
Just change the head out, right?
Well, change the head out, or these, if they don't change the head, just throw them away.
Got it.
The problem is they sit in that warm shower, which is like the perfect place. It's like a petri dish.
For mold,
bacteria. So if you can take them out at night and let them dry on the counter, that's even better.
And then when you're shaving, you're open.
You're just asking for it. You're just asking for it.
Okay.
So what about your body? Everyone's into exfoliating right now. It's springtime, clean time. So body exfoliators, Aveeno has these great body exfoliating products as well as Neutrogena. You want to look for salicylic acid, alpha hydroxy acid. They'll say brightening and lightening. The key to exfoliating is, remember, don't do it every day. Don't mechanically exfoliate and chemically exfoliate at the same time, right? Because these are chemical exfoliators, and patients come in all the time and they'll do this and then they'll get that and scrub, and you're just kind of overdoing it with your skin. It's too much. So pick a lane. Don't do it every day. Every third day is a good choice. If you're more sensitive, maybe once a week. But the other thing to remember is it does make your skin barrier more sensitive to the sun. So when you're using facial exfoliators in particular, so a lot of these Neutrogena, La Roche products, they have the same alpha hydroxy, beta hydroxy acids in them, retinols. They're all taking off that top layer, right? Which is kind of like that curtain in the window, right? Revealing beautiful skin, taking off that dead stratum corneum, but now the light's shining through the window.
More vulnerable.
So you need more sunscreen. So remember, if you're going to exfoliate, it's springtime, step up the sunscreen. So always use, you know, we always say SPF 30 or higher, zinc-based. I love these sticks. These are my favorite because you can keep this in the glove compartment of your car. You can put it on your hand.
Little sunscreen stick, huh?
Yes. Keep those spots off your hands. There's a bunch of different options from different brands, but they go on transparent. They don't smell. And men love these. They're like, I'm not going to put on sunscreen, but I'll use that stick.
It's easy, convenient. What about expiration dates, Dr. Ingraham? Because this is something that honestly I don't really think about. I use a product until it's done, and then I throw the container in the recycle bin. Should we be paying attention to those dates?
You should. Now, smell is the first test. Something that is even before the expiration date, sometimes it'll start smelling, throw it out. We live in a hot, warm Houston environment. Throw it out.
Smelling like what?
smelling foul, smelling moldy, smelling yucky. That's
not
really,
fresh.
really important. So that's important. But all products do have a date on them now. So you can lift up the product and it'll have a little circle and it'll say like 12 months. That's 12 months after you've opened it, throw it out.
Okay.
Okay, so look for that little circle on the back with a little date.
And are you liking like the mineral sunscreens right now, or what for this
sunscreens
for this
are
season?
really, really great. They're sheer mineral sunscreen now and tinted. Remember, tinted sunscreens block blue light.
And that's like computer light and studio light.
Exactly.
Okay.
So, but what if you really, really, really want to brighten up for spring? You got to take the cold water plunge.
Oh, a cold water plunge, you say?
Am I the victim today?
You are the victim. So
Yes.
come on over.
Okay, so can I tell you, Brandon, a couple weeks ago, I went downstairs and I was like, what? I thought something was wrong. Brandon had his whole face in a bowl of ice.
Ooh, he is ahead of the curve.
He's
I
ahead of the
like
curve.
it.
Okay, so what am I supposed to do?
Okay, so first of all, let me give you a pep talk. You're doing this because you want to constrict the vessels, reduce inflammation, move the lymphatic fluid.
Yes,
So
those are the benefits, Derek.
Those
You
are
got to
all
focus.
the benefits. You got to focus when you go in for the game. So then we're just going
Ready.
to dip your face in there, and
Okay.
less than a minute's fine, but you can do it for a few seconds.
How far does my face go in?
As much as you can do it. I'm not going to
Hold your breath.
Okay.
There you go.
Okay.
Okay.
Ready? Okay, so welcome to the Houston Live Show without Derek.
Right? Now, you know
Hey,
what?
that wasn't long enough. Get back in there, dude.
Get back in the mold.
Come on, man.
Back in the mold.
Okay.
I've been waiting for this moment my whole life. He can't last. Dr. Ingraham, he can't do it.
But the point of this is it's going to constrict the vessels. It's good to do in
Listen,
the morning.
we're coming back. We have to take a quick break. I cannot thank you enough, Dr. Ingraham. Houston Life will be right back. Derek, come on.